Good morning. It is Monday, July the 19th of 2021, and Dr. Beck is up and running wild this morning at LifePoint Medical. So we are up working. If you need us, give us a call. I will let you know that we are very short of staff this week because of vacations and all this other stuff. So we're going to keep our promise to you that we'll see you if you need to be seen. Please be patient with us. Our limiting factors is not the providers. It's the support staff that we have, and they just needed to take a vacation, and I get that. So just be mindful of that. So let's talk about, I want to give you a little bit of a housekeeping thing that I'm seeing that is a little bit disturbing to me in a sense that I don't like the concept. The thing is, and it's about Medicare patients, be careful with your Medicare benefits, okay, because we have these things called Medicare Advantage plans in which they take over your Medicare benefit. And I'm pretty sure it's a one-way street, like if you do it, you can't go back kind of thing. And the issue that I'm having with it, and the thing that I want you to work out with before you do them, because I'm not saying not to do them, I'm just saying you've got to do some homework because what's happening is they're appealing to people's desire to save money on a monthly basis. In other words, they offer you these plans and they're nothing, or they're quote free, which they're not free. It's just the government's paying them instead of paying me, and then they pay me what they think I should get, kind of deal. But what they're doing is when I try to send somebody to therapy or send them to a specialist, the patients don't want to go because it costs too much money. In other words, they have a copay with their specialist or with particularly therapy, which is something they can't afford. I think about 3 times last week, I was wanting to give people physical therapy and they needed to get it 3 times a week, but their copay for the therapy is like $50 per session. And I know the therapy guys, I've talked to them about it, and this has really hurt their business in the sense that do it. So what they're doing is all these advantage plans that have no monthly fee to them, they've got to get you from somewhere, okay? And the way they're doing that is every time you interface with the medical community, whether it's seeing me or getting an x-ray or getting therapy or whatever, you're going to have to pay something, okay? And I don't like that. I've always tried to not, I can't treat people based on money. I can't. I got to treat people based on what I think's best for them, and that just factors in the money thing. Which, like I say, if I say you need therapy, and they say I can't afford therapy, I said I think you're on Medicare, and they're like, well, no, we're on a Medicare Advantage program. We have to pay $50 for the therapy, and that's where I get a little upset. And I'm not sure if everything was explained to the patient when that happens, and it just irritates me. But anyway, you don't want to get caught in that where you need therapy. The other thing about that is you may be fine while you're signing up for these programs and don't need a lot of stuff, but the next day you can fall and get hurt and you're going to need all of these things, and that's where they get you, okay? So I'm not saying no, just pay attention to what they are selling you and make sure it fits your lifestyle and your budget. Okay, the other thing, I've been doing these audits. I've been having the people come in and audit what we're doing. And one of the things that they say that we absolutely can do a better job at is doing the annual wellness visits. And we try to push those. I mean, we're not pushy, okay, but we want people to get the annual wellness visits done. And the main reason I want you to get it done is more for your health than mine, in the sense that when we do not do an annual wellness visit, we miss an opportunity to maybe treat a disease that you would not necessarily have to experience in its full totalis. And we've really been, this has really been accentuated by the COVID thing, because as soon as COVID kicked off, nobody wanted to do any more wellness checks. And even the government said, don't have people coming to your office. The problem is is we're going to see people coming in these next couple of years with more advanced disease than they, in other words, the cancer is going to be further along than if we'd have caught it when it was earlier, stuff like that. Okay, so we really want to encourage you to get your annual wellness visits. It's prepaid. You're already paying for this with your insurance company. Okay, it's more like something that you've already paid for, and you just need to get your benefit from it. And I don't want you to miss that benefit of early intervention. Okay, I see it too many times where we change the course of somebody's life because we looked somewhere that we wouldn't have naturally looked at. And that's what the annual wellness visits are all about. And we're going to be working at and getting more of those done. Okay, and our attitude is if we do a really good job with our annual wellness visits, people will live longer and we will save people's lives. And that's what we're going for. So just keep that in mind. Now, in the interest of time, I'm going to keep rolling. We had 1,600 coronavirus cases, and that's one up from Friday. So we've added one over the weekend. And so just stay diligent and watch after yourself with that. And no more deaths, thank the Lord. Okay, it's Monday. We're hard at work. We want to hear from you, and we will get you taken care of. Thank you for listening to me, and have a good day.